with a $53 billion endowment, spends 69% of its money from NIH on overhead, does it not?
I haven't looked at the latest numbers, but it's definitely in that range.
Yale spends 67.5% on overhead, does it not?
Again, roughly in that range, yes.
So all this money spent on overhead is money that's not being spent on medical research. Is that right?
Well, it's for fixed costs of like lab space and things, but also sometimes for other things. So it's some of it's absolutely necessary.
Well, if I'm the Gates Foundation, and I came to the NIH and said, I don't want money. I want to give you money. I want to give you $100 billion.
Yeah.
But you can't spend more than 10% on overhead. Would the NIH turn it down?
Doctor, you don't look like Satan to me. It's not every day a U.S. Senate hearing feels like a courtroom drama. But what happens when America's top doctor is grilled over millions in taxpayer-funded research dollars? From yacht-level waste to jaw-dropping NIH stats. This hearing wasn't just political theater. It revealed a brutal truth about how medical research is funded in America. Let's break it down. It started with a curveball. Some of my colleagues have accused you of everything but abandoning your children to wolves. But behind the flare was a serious concern. How much of our NIH funding is actually going toward cures, and how much is going elsewhere?
Doctor, you don't look like Satan to me.
I hope not.
Some of my colleagues have accused you of everything but abandoning your children to wolves. Do you hate medical research?
I've devoted my life to medical research, Senator.
Do you hate the NIH?
I love the NIH. I think I said that in my Senate hearing, my earlier Senate hearing. I think it's the most important biomedical institution in the world.
This budget that we're debating today is the president's budget. When's the last time Congress took a president's budget and enacted it?
You know, the funny thing is, I've gotten thanks to this process, I've got to talk with all of y'all.
When's the last time that happened?
I can't remember.
It's never happened in the history of ever happened.
I mean, everyone has strong opinions about what should happen, and Congress gets to have a say, and that's a good thing.
There's some changes that need to be made at the NIH, aren't there?
There are.
Okay. If I'm the president of a university, and I came to you at the NIH and said, I need $10 million to research a cure for nephritis. And I took that $10 million and spent $5 million of it renovating the vice provost home. That would be morally repugnant, wouldn't it?
It would.
If I were a college president and I came to NIH and asked for $20 million to research a cure for dementia, and I took $5 million of that and used it to buy a yacht for my university, that would be morally repugnant, wouldn't it?
That would, and no, that's not.
And that's happened before, hasn't it?
That's not hypothetical, alas.
And there's been a lot of talk about the difference between direct costs, spending the money, for example, on researching cures for nephritis, and indirect costs, overhead. Harvard, for example, with a $53 billion endowment, spends 69% of its money from NIH on overhead, does it not?
I haven't looked at the latest numbers, but it's definitely in that range.
Yale spends 67.5% on overhead, does it not?
Again, roughly in that range, yes.
Harvard spends 69% of its NIH grants on overhead. Yale? Around 67.5%. Overhead isn't just lab lights, and a C, it can mean administrative fluff, fancy offices, and yes, even luxury perks. Is that where our research dollars should go?
Yes.
So all this money spent on overhead is money that's not being spent on medical research. Is that right?
Well, it's for fixed costs of like lab space and things, but also sometimes for other things. So it's some of it's absolutely necessary.
Well, if I'm the Gates Foundation, and I came to the NIH and said, I don't want money. I want to give you money. I want to give you $100 billion.
Yeah.
But you can't spend more than 10% on overhead. Would the NIH turn it down?
I wouldn't turn it down, no. In fact, I think that Gates Foundation overhead rates are roughly, again, in that range, 10 to 15%.
The Robert Wood Johnson Foundation limits overhead to 15%, does it not?
That's what I understand, something like that.
Now, I want you to think in terms of the American people and the importance of medical research. What do you think is more important? And we have finite resources. Okay, and I support giving resources to NIH. I think NIH does breathtakingly innovative work. But if you ask American people, would you rather give money to research cerebrovascular disease, or would you rather give $142,000 to the Seattle Children's Hospital to study how to use telehealth to improve access to gender-affirming care? What do you think the American people would say?
Senator, the NIH should be a non-political organization, non-ideological, addressing the health needs of the American people.
But yet, the NIH also spent $120,000 in a grant to, quote, develop 3D avatars that help people work through gender dysphoria, end quote. Did it not?
It did.
And the NIH also spent $2,368,492, gave it to Brown University to study, quote, improving mental health among the LGBTQ community impacted by the COVID-19 pandemic. Did it not?
I think it did. Although I have to say that Do
you think that's more important than studying chronic lower respiratory disease?
I mean, I think we should address the real health needs of Americans, not divide Americans into we have to take into account the real differences in in the biology of people. But when we do that, we should do it in a way that really addresses their actual health needs. Not
I'm running out of time. What we have to do is spend the money on research.
We should, absolutely.
It's real simple.
I agree with you, Senator, 100%.
And some universities aren't, and NIH is not calling them on it. Isn't it a fact that a study showed between 2017 and 2019, auditors found 137 critical trials funded with taxpayer money involving 41,000 kids, and they didn't even report the results? What happened to the money?
Senator, I think that researchers we support have an obligation to share their data publicly with the American people, no matter what the result.
Otherwise, it's wasted.
Yeah, agree.
All you want to do is fix NIH, don't you?
I do. I want to fix all those problems, Senator.
Thank you, Madam Chair.
Thank you, Senator Kennedy. Senator Britt?
You give $20 million to a university to fight dementia, and they use $5 million of it to buy a yacht. Sound ridiculous? That's not hypothetical. It's happened. The question, is the NIH holding these institutions accountable? The senator asked if the NIH would turn down a $100 billion donation with one catch: no more than 10% can be spent on overhead. The doctor said he wouldn't. Neither would most people. But then, why do universities get away with up to 70%? If you're passionate about truth, accountability, and making sure science works for everyone, hit that subscribe button. We go beyond the headlines to dissect the real issues behind the soundbites. Tap the bell so you never miss a moment of clarity in a sea of confusion. Now back to it. Here's where things get heated. $142,000 to study telehealth for gender-affirming care. $2.3 million to study LGBTQ plus mental health during COVID. Important topics? Yes. But are they more urgent than cures for chronic respiratory disease, cerebrovascular illness, or cancer? With finite dollars, The fight is over what matters most, and the public deserves a say. This one's hard to swallow. Between 2017 and 2019, 137 clinical trials involving over 41,000 children, funded by NIH, did not report results. That's your money. That's our data. Lost. The doctor admitted it. If results aren't shared, the money is wasted. And that's the point. It's not just about money. It's about trust. And if NIH wants to keep that trust, it has to do better. This isn't about right or left. It's about making science work for the people funding it, the American public. The doctor at the hearing didn't look like Satan, but maybe the real villain isn't a person. Maybe it's a broken system. What do you think? Should NIH be reformed? Should spending be capped? Should priorities shift? Feel free to drop your thoughts in the comments. Let's talk. And don't forget, if you want real talk without the spin, subscribe and stay tuned. Because information is power, and the truth deserves a spotlight.